Thanks, guys. So I'm David, this is Tyler, and today we'll be discussing the HIV prevention needs for young adult Black same-gender loving men.
Cool. Hi, guys. How's everyone doing? It's been a lot of presentations. Okay. So in recent years, we've seen a lot of different conversations been happening about HIV being at its end game, so being at the tipping point of the work that we're doing here in this room. And that's true. 30 years into the epidemic, we've seen great progress made throughout the cascade, so all the way from prevention, treatment, care, engagement. But what we've also seen is that we're still seeing that this progress is not being realized in the same way throughout different communities. So in HIV, we can still see that we have priority populations that are experiencing disproportionate new HIV diagnoses. So GBMSM, a lot of the folks in the room today, ACB, African, Caribbean, Black communities, Indigenous communities, women at risk, and people who use drugs. So despite this knowledge of the disparity in access to the progress that has been made, David and I noticed that there is really just a dearth of research and attention being made for Black SGL men. So we're going to be using the term SGL, same gender loving. So when you hear Black gay men, Black SGL men, that's going to mean the same thing. So despite Black SGL men residing at the precarious intersection of two of the groups most affected by HIV, we can see throughout the Canadian literature and Canadian research, Canadian policy, that experience, that reality is largely erased. And that's what brought us to this research project that we're going to be presenting to you today.
So given the lack of data and the poorly collected data that does exist on Black SGL men, what we do know, thanks to the work of Lana James and Todd Coleman, I think from their presentation at CAR 2018, they produced an epidemiological report that looked at Black SGL men. And what we found from that report is that Black SGL men represent or report an 8.5 times greater burden of HIV diagnoses when comparing the estimated proportion of Black SGL with that of the Black population. And this long overdue epi information about Black SGL men gives us an important snapshot of some of the disparities that we face. So again, this is the work of Lana James and Todd Coleman.
So what were we trying to achieve with this program of research? Well, you can read it for yourselves. We were trying, oh, thank you. Now you can read it for yourselves. But we really just wanted to understand what are the HIV prevention needs amongst Black SGL men.
So with that being said, we conducted focus groups with Black SGL men between the ages of 16 to 29 in Toronto and Ottawa, given the large proportion of Black folks that live in those regions. And recruitment for participation really occurred through convenience sampling. So we utilized our personal networks and our social networks to promote the focus group via social media and through word of mouth, and that kind of led to a bit of a snowball effect. We also sent out some promotional materials to our community partners like ACCHO and Black Cap for them to circulate it across their networks. And our eligibility criteria was quite broad, with folks just having to be between the ages of 16 to 29, identifying as SGL or being HIV negative.
So we really wanted to achieve three different things with this program of research. So first of all, we wanted to explore the varying HIV prevention methods and toolkits amongst Black SGL men, all right? The second thing that we really wanted to do was to figure out what are the key issues affecting Black SGL men. So what's really standing between Black gay guys and optimal health and well-being? And thirdly, we wanted to identify some areas for improvement.
So in the following slides, we provided some high-level themes that emerged through the first initial run-through of the data, the focus group data. So at the time that these slides were created, we had just completed the Toronto focus group, but the Ottawa focus group was coming down the pipeline. So of the 10 folks that participated in the Toronto focus group, 8 of them were willing to complete a demographic questionnaire. And despite the overall small sample size, we did want to still provide a bit of a snapshot of who participated in the focus group. And as you can see, in general terms, it was largely Black Caribbean folks who were born in Canada with Canadian citizenship, and most of them were making an income of over $50,000. In comparison to Ottawa, we saw very similar trends, except that it was with Black Africans with precarious citizenship. So with regards to the first objective, one of the initial themes to emerge was the idea of HIV prevention as a method of community care. So when discussing the ways in which people manage their sexual health care, a lot of folks in our focus group mentioned the use of their social networks as the ones that would provide the majority of the knowledge and support. So for example, in discussing recent hookups or potential symptoms, participants really looked to members of their social group for advice in regards to the next steps. And some participants, those who were on PrEP, also became unofficial PrEP ambassadors to the point where they were speaking about the methods in which they used to access PrEP, and they're answering general questions about being on PrEP, and along with the folks who tried to get an understanding of what some of the symptoms were or the experiences that they were having on PrEP. And we also heard from folks who went with members of their social networks to go to testing and routine treatment just because folks in their social networks were sometimes faced with anxiety when it came to getting tested. So really, again, this idea of members in the community or within their social networks really taking care of one another.
So another big theme that came out was around PrEP awareness. So of the 17 participants between Ottawa and Toronto, we saw that only 2 of the guys were actually on PrEP. In Ottawa, we saw that 3 guys actually didn't really know what PrEP was until they came to this focus group. So going on that train of thought, the participants really expressed some concerns about PrEP, mostly being that how do we know that the guy that we're hooking up with is actually on PrEP, or is he just saying that so that we can have condomless sex? So really that idea around trust. Most participants between the 2 cities felt like they didn't have enough information about PrEP to make an informed decision about whether they should go on PrEP themselves or how to engage with different partners that they're hooking up with that say that they're on PrEP. The option to go on PrEP was not always presented to folks, to Black SGL men when they'd go in for STI testing or HIV testing. PrEP wouldn't come up. And as we saw, they were also saying that some of them didn't even know about PrEP. It really raises the question of what's the role of primary care practitioners in talking about PrEP. Some of the fear towards using PrEP was really around the long-term effects of it. So what does it look like to be putting a medication in my body? And participants raised confusion, particularly in Ottawa, about why it was that when they were told about PrEP, it was usually from white gay guys that they were hooking up with, seeing, friends with, but the same level of information wasn't really present in their own communities as Black SGL men, and also about access. So why was it that they were seeing all these white gay men who are on PrEP, and then seeing that in their own communities, very, very few people even have access to this drug?
So with regards to our second objective, so the key issues affecting the sexual health and well-being of Black SGL men, one of the major themes that quickly emerged was the idea of accessing care, the issues that come with accessing care. So in Toronto, out of the 10 folks that were in our focus group, only 2 of them were aware of AIDS service organizations, and of the 2 that had known about AIDS service organizations, both of them had negative experiences in both ASOs to the point where they were no longer interested in receiving care or services from those places. So we saw that a lot of folks would access care from sexual health clinics, and the majority of folks had trouble finding a primary healthcare provider who they could be out to due to issues like mentioned in previous presentations where sharing a healthcare provider with their family could lead to things of lack of privacy, their healthcare provider not being knowledgeable about gay men's health and HIV, or their healthcare provider not being comfortable with the tests that come with gay men's health. So for example, oral swabs, rectal swabs. And there was an overall stigma to HIV and gay men's health from their primary healthcare providers.
Another big theme was really the one of not being queer enough, but also not being Black enough. And I'm going to talk about what that means. So it really gets to this idea of anti-Black racism, homophobia, and microaggressions, which were common themes throughout both cities, given that these two focus groups, they didn't even know each other, but by virtue of their identity being in different cities, they're experiencing a lot of the same barriers to optimal health and well-being. So participants really spoke about at non-Black organizations, they would go in, they wouldn't really be read as being gay, and therefore wouldn't receive the services that come along with gay men's health. But then when they would go to ethno-racial specific organizations, so Black organizations, they would be read as queer very quickly and have to deal with the consequent homophobia that comes along with that. And then in both of those situations, whether it was at an ethno-specific organization or at a non-Black organization, they would say that the assumptions were being made around the types of sex they were having, usually being that they're having lots of sex and that they're having lots of risky sex. So again, we can see how stereotypes not only about the promiscuity of gay men, but also stereotypes about the over-sexualization of Black bodies were present in the experiences of those who participated in our focus group.
And then with our last objective, identifying areas for improvement in HIV prevention service provision to Black SGL men, participants in both focus groups really stressed the importance of going to spaces that were inclusive and affirming of both their queerness and their Blackness. They felt like there shouldn't be a need to sacrifice one of those identities for the other or really experience any discomfort in the process. Participants really interestingly didn't express a preference to attend a ethno-racial specific organization or an organization that served like the general population. Like the main goal for folks was really to go to a place where they could be their true selves. And in addition to this, in the Ottawa focus group, participants really wanted to talk about the ideas of combating homophobia and the myth that like there are no gay Black people or there are no gay trans people. And they really wanted to focus on organizations focusing on doing more outreach in public that highlights and showcases Black queer love and showcases Black queer and trans folks. So we've kind of mentioned a lot of themes and a lot of information. So some quick takeaways or lessons learned. The folks in our focus group, specifically in Toronto, were not aware of ASLs, the staff, or your organizations, or the work that you're doing, and that included ethno-racial specific organizations. And consequently, any of the messaging, the programming, and the services or outreach efforts that you and your organizations are really putting forth are consistently missing Black queer folks or Black SGL folks. And a lot of that sexual health information we've learned comes mostly from members within their own social networks. And one of the main barriers that people are facing, as you can imagine, is anti-Black racism and homophobia when trying to receive care, and that's creating additional barriers to get knowledge and services outside of what's being present in their social networks.
So I wanted to talk just briefly about some of the limitations of our study. So obviously it was quite a small sample size. So we're hoping that this work can be picked up, well-funded, and done on a larger scale. So there can be more generability with it. Convenience sampling, so we did recruit within our social networks. So once again, we're looking for this to happen on a larger scale. And also social desirability bias. So because these were folks largely within our social networks, and we're talking about HIV, sex, sexual health, and just like other gay stuff, maybe folks felt like they wanted to be seen as favorable in the eyes of myself in Ottawa or David in Toronto. So this bias also could have been a factor.
So some takeaways. So if you don't already, those of you in the room really and truly have mandatory anti-racism and anti-oppression training. Oh, thank you. So yeah, make sure that you have mandatory anti-racism and anti-oppression training for staff to be completed on an annual basis, and to make sure that for new staff as a part of the onboarding experience, that this is a mandatory piece. And it's important to also recognize that Black SGL men don't fit into one particular mold, or is not one homogeneous group. It's not like the term ACB, like there are multiple people within that one term. So again, it's important that we be mindful of like the vast diversity within Black SGL communities, and when doing this work, that both the outreach and programming comes from a place that recognizes and understands the local social and cultural experiences of these men. So for example, if you're doing some outreach that is targeting like the butch queens versus like those folks who are very discreet, or the trades of the Black SGL community, like be mindful of the histories that are in place and be mindful of the particular contexts when doing that work. Another piece that we wanted folks to really take away with is understanding that given that most of the people in our focus group had no knowledge of ASOs, that there is really a need for a shift in the way that HIV prevention is being done within organizations, and it should be taking a more community-based approach where it's being done with the aid of community champions. So working with community champions to allow ASO's programming to really start to enter the social networks of Black SGL communities, as we've learned through our focus groups that this is the primary route of knowledge sharing within our communities. And make sure that you're paying the people for this work, because it's hard work. And then one other piece is around the use of biomedical HIV prevention efforts. So for example, like PrEP clinics. So again, taking PrEP clinics and bringing those programmings and shifting from an ASO or a clinic approach and embedding that within predetermined or established community programming that's specifically for Black folks. So again, we're going to a place with folks in our focus group talked about the idea that ASOs, they don't know about ASOs, or they're entering certain spaces where they're not being read as queer. So in an effort to bring biomedical approaches to pre-established community outreach efforts that service Black folks, where you're meeting them where they're at, you're meeting them in spaces where their Blackness is affirmed and their queerness is affirmed. It's really going to be the correct or a more effective delivery agent for HIV prevention efforts. And then lastly, a quick plug is to read a report. So we have a report that we're working with the GMSH that's in the pipeline, where we're doing a much more in-depth analysis of the focus group data and providing additional recommendations for all of your organizations.
Almost done. We're not done. We're not 2 more seconds.
1 second.
So there's a quote up here that's really important. Black gay men must be the authors of our own narratives. So while we most certainly have the tools to end the HIV epidemic, we just have to be really considering if these tools are being used where they're most needed. And especially within the context of the decade, the United Nations decade for people of African descent, it's really important to have this work echoed throughout Ontario, because it is work that's being done on the world stage as well. And we'd also like to acknowledge the GMSH, the Gay Men's Sexual Health Alliance, for making this a financially feasible project for all those involved, and all of the amazing community members that were willing to step into a space of vulnerability with us and really speak their truth. Thank you so much for your time.